At Platte Valley Medical Center, our mission is to foster optimal health for all. To further that mission, we have embraced the Planetree philosophy of patient-centered care. At our Planetree retreats, we provide staff with a PhD, which stands for Personalizing, Humanizing, and Demystifying the Healthcare Experience. We recently blended our excellent clinical outcomes with exceptional patient care to provide a life-saving experience for Marvin Bangert and his family. Marvin was in full-blown cardiac arrest when the EMTs arrived at his home. Thanks to our advancements in critical care and cardiovascular services, we were able to transport and treat him here at PVMC.
We arrived on scene, we went inside, the patient's wife met us and directed us downstairs. We went downstairs and found the patient laying on the floor. He was unconscious and unresponsive. We went ahead and started assisting his ventilations and put him on the monitor, and he was in VFib, and we shocked him and continued compressions. We shocked him again, and we got back a wonderful pulse-producing rhythm. And so we went ahead and loaded him up and took him to the hospital, and it was wonderful.
I had a good feeling about this patient. I really had a good feeling that he will be fine, even though he was very sick.
We believe that every patient and their families have unique and special needs. One of our goals is to include families in the patient-centered care experience.
If you could imagine someone coming in and pulling out all these strange gadgets and scary-looking tools and needles and not having any idea what's going on, you would think that it was pretty bad. And I think about the family, and I like to stop in the middle of a call and let them know how things are going and be honest. We're doing everything we can, but they're an extension of the patient. In a way, they're a patient themselves.
To relate with the family members and understand that they are also going through this as well as our patient, and continuing to realize that the person we're taking care of has a life outside of here, has a family member, and just respecting that and their dignity and privacy throughout their stay here is really one of our priorities.
Mostly I just had opportunity to talk to them, so I just let them talk, and that's mostly what they needed. She just needed to vent, and I was there.
We believe we are human beings caring for other human beings. One of our goals as a healthcare team is to be both courteous and respectful to our patients and their loved ones.
You always they have to trust you, they have to feel comfortable, you know. You have to always break those barrier or ice between you as a doctor and, you know, your patients and the family. You don't want to be, okay, I'm the doctor and you are, you know, the patient. So you listen what I said, and I am the professional. So as I said, I start with a joke, you know, break the ice, make the patient or the family, you know, smile. So then they know, okay, this is this person, you know, we can trust or we can relate, you know. And then sometimes I sit next to them, try in an appropriate way, you know, either hold their hands. I like to tap them in the shoulder, and that's kind of make, you know, your relation with you and your patient, and you make them so comfortable and they trust you. And once your patient trusts you, I think that's like 50% of, you know, your rapport with the patient and his family.
That the first 24 to 48 hours was very unknown for them. We were cooling him post-cardiac arrest. There was a lot of questions on brain viability after he was re-warmed up. So the family had a lot of questions on what type of functioning level he would be at.
Since I've had experience waiting in a waiting room, I figured that's what I would want, and it helps a lot. Sometimes just have somebody to talk to, and or sit and hold their hand.
We believe communication is an essential part of the healthcare experience. We need to listen carefully and explain things in a way that our patients and their loved ones can truly understand.
Yeah, absolutely. I mean, they have to understand what you are saying, because then if you don't communicate good, if they don't understand you, then they won't trust you. They don't know what you are doing. So I try my best to make them understand, speak as simple as possible, so everybody's comfortable. They know your plan. They know what you want to do.
To help the family and make them feel more at ease about everything that's going on, we try to explain all the equipment that we're using, because it's pretty scary to see all these weird looking things that make noise, and so we try to explain in simple terms what each one provides. For example, the tube down their throat is giving them air, helping them breathe. And the family usually seems to understand, and they do appreciate it.
Explaining one-on-one with the family members and the sister-in-law about the cooling system after a post-cardiac arrest. And I think just really sitting down one-on-one on them and explaining that we will be taking his temperature down to be able to have his brain have as much functioning as possible, and then after 48 hours we would be rewarming him up. They were able to grasp the concept of what we were doing.
Marvin, walking out of the hospital just 5 days after this critical event, is evidence of the superior clinical care provided here at PVMC. We can all use our PhDs to personalize, humanize, and demystify the patient care experience. Thank you for positively contributing to our achievements as a Joint Commission top performing hospital and to the overall patient care experience at Platte Valley Medical Center.